Okay, so good evening, everyone. I hope you're all keeping safe and healthy, regardless of where you are in the world. It's really so nice to see all of you watching our stream tonight. There's a couple of people tuned in already. So just to introduce myself, I'm Joko, and I'll be your host throughout the evening. So tonight, we've invited entrepreneurs that are changing the healthcare scene here in the Philippines. They're going to be talking about why innovations in healthcare are so crucial in this day and age. And I'm sure that this is something that a lot of you can agree with as well, given this whole pandemic situation we're in. And so our event tonight will run from 7 p.m. all the way to 8:30 p.m. And we're going to start off with introductory remarks from Carlos, our head of partnerships at Make Sense. He will then be followed by Carl Nang, the CEO of LifeTrack, sorry. And to cap off our event, we're going to have a panel discussion with three amazing health startups that are going to be launching this year. I've also prepared a small surprise for everyone as well at the end of the event. So please look out for that. I'll be introducing an online platform called AirMeet that'll allow all of you watching our stream right now to network with our speakers as if you were in an in-person event. So I'm honestly so excited for this part, and I'm so in love with the AirMeet platform. And I'm sure that all of you are going to love it as well. So please stay tuned until the end. I'm going to be sharing my screen now. I hope all of you can hear me well. All right. So, without further ado, I would like to start our event by introducing all of you to Carlos Echanova, our head of partnerships here at Make Sense. Carlos is also the program lead for our Health for All innovation program, and he worked very closely with the startups that we'll be featuring at the end of this webinar. Because this is an online event, I know it's going to be pretty awkward if I ask all of you to give Carlos a round of applause. And so instead, we've innovated a little bit. I would like to ask all of you to flood our Facebook live stream with likes and heart reacts to welcome Carlos to the screen. I'm going to be unsharing my screen right now. And Carlos, feel free to turn on your video and start when you're ready.
Sure, thanks, Jocko. So I guess I'm ready right now. So I don't have Facebook open right now, but I'm assuming there's a stream of hearts flowing over there. So I'm gonna start out by saying that, everyone likes being right, right? So before I present anything on the screen, let's start out by getting things wrong. I wanna ask you a question that you're probably going to answer wrong. And this is the question. What percentage of the Philippine population is reported to receive financial assistance to access basic healthcare? I'll repeat that. What percentage of the Philippine population is reported to receive financial assistance to access basic healthcare? Now, if you're not from the Philippines, it's totally all right. I still encourage you to give your best guess, and I'll give you 5 seconds to think about that, but no Googling. All right. All right, so I hope you guys can see my screen right now. And I hope you have that number in your head as well. So here is the actual answer. Where's that? 98%. Is that the number that you're expecting? More specifically, 98% of the Philippine population is reported to be covered under PhilHealth and therefore have financial assistance to access basic healthcare. Now that sounds great, but why doesn't that seem right with what we've seen from our healthcare system? And why is social innovation one of the best solutions we have to ensure the health of every Filipino? I'm going to answer that, and I'm going to tell you that in 2 stories. The first story starts with community and the ripple effect, and it's going to start with another number, 1.5. It's estimated that every year, 1.5 million families are pushed into poverty because of out-of-pocket expenditures on healthcare. And that's families, not just individuals. And I'm not telling you this to, pick on healthcare for PhilHealth. And I'm definitely not trying to sell you health insurance right now. But I think this points out two important things. One is that access to healthcare has multiple dimensions to it, not just financial. And the second is that when we talk about health and having a public health crisis right now, we're actually talking about a lot more than just health. So Make Sense is continuing its third year of our health innovation program. And we started this year by doing an informal study of what the program specifically needed to address. We found there were 5 main factors that encompassed access to healthcare in the Philippines. There's financial barriers, health workforce, service availability and delivery, especially important for our rural areas, and with the Philippines made up of an archipelago of islands. Patient education at 4, because health can really easily get too technical or complex for the layperson. And 5, health information, or making sure our health professionals are consistently working with solid information. Now, these are key challenges, and they're not new, but when COVID-19 hit, they just kind of blew up. They came to the very front and center for every Filipino. And I don't think I need to go over the numbers and the cries of our frontline health workers, because I'm sure that by now, you're all too aware of them. But the response from our communities from all over continues to inspire me with how quick, creative, and concrete they are. With mass public transport suspended during the quarantine, our health workers had a hard time just getting to their workplace. And the community responded. Let's do mass lending of bikes. Let's create an app that helps them move around for emergency dispatching. With our healthcare system under-equipped and overburdened, the community responded as well. How about we utilize 3D printing to create face shields on our own? How about we create and freely share designs for emergency quarantine units that can be built as soon as possible? And when the citizens themselves said, I'm panicking, I don't completely understand what's going on. How am I going to cope with it? What can I do to help? Other citizens responded, let's help with their mental health. Let's repackage information in a way that's very easy to understand and access for every Filipino. And there are countless other examples. Now, the amazing thing with that is that most of these responses are from people who aren't doctors or nurses or scientists. They're regular citizens like you and me. And because the public acted with speed, adaptability, and creativity, we were able to fill a lot of gaps with our healthcare situation. With all these citizens from different backgrounds joining in to be a part of the solution, what does this tell us about the nature of the crisis we're in right now? It tells us that this is more than just a health crisis. It affects us economically, politically, socially, psychologically, and it affects our environment too. Ultimately, this is a humanitarian crisis. But it all starts with health, and every other effect ripples out from it, and it starts early. So this is the second story, and it's about social innovation. Let's start with Dr. Winston. This is him. 3 years ago, through our health innovation program, we helped him launch a social enterprise called Squeaky Clean Kids. It's a brand of organic soaps made with natural ingredients and unused soap bars from the hotel industry. And every bar of soap you buy from them is used to pay for another bar of soap for a child in need, and for Dr. Winston to go around local communities and schools to teach kids proper hand washing. That was 3 years ago. By now, through instilling the habit of good hygiene and proper hand washing, how many lives and families do you think Dr. Winston has been able to protect, especially now with COVID-19? And admit it, the simple everyday act of hand washing was probably something most of us took for granted before this pandemic. But Dr. Winston wasn't able to just wake up one day and instantly start creating that kind of impact. 3 years ago, he came to us and basically said, hey, I'm a doctor. So I'm knowledgeable about health, but to make this bigger impact that I dream about, I need so many other skills. And that's where we were able to help him out. He knew that there was a gap between where he was with his idea and the impact he wanted to create through a social enterprise. So we helped him bridge that gap with some obvious things like business skills, how to organize a community, and setting him up with the right network. But also with the less obvious things, like providing him with a community of innovators where he wouldn't feel alone in his mission, but inspired by others with similar missions. And that is one of Make Sense's specialties. More generally, we're a global nonprofit engaging citizens to make an impact on the social and environmental challenges that matter to them. And we do this all over the world, impacting dozens of organizations, social startups, and citizens. We're supported by organizations like the Obama Foundation, the Bill and Melinda Gates Foundation, and many others that I'm sure you recognize on the screen right now. And at the end of the day, what we're trying to develop is a more inclusive and sustainable world. Which brings us back to health and our Health for All program. So we're in our third year, and just like with Dr. Winston, we're supporting entrepreneurial solutions addressing access to healthcare for all. And at the end of last year, we launched that with a 2-day hackathon that had 6 new projects born. And at the start of this year, through a 6-week online coaching program involving 11 social startups. Tonight, you'll get to meet 3 of them. And I don't want to spoil things, but I'm excited for you to meet them because I think they really embody the same positive characteristics as the previous stories I've told of our communities and of Dr. Winston and the impact they've been able to create. And I hope you're excited to meet them as well, because again, at the end of the day, there is so much at stake over here for us. And it all starts with health. And if you've been moved even just a little bit by these very short accounts of ordinary citizens making a concrete impact with speed, adaptability, and creativity, and in a way that's collaborative and sustainable, then you already believe in the power of social innovation, because that is what a solution driven by social innovation looks like. And if you believe in the power of social innovation now, then I hope you can see how it can be our solution to the humanitarian crisis we're all in right now. So that's all from me. Thank you, and please enjoy the rest of your evening.
All right, can all of you please flood our stream again with a flood of likes and heart reacts? Thank you so much, Carlos. So I don't know about all of you, but I never knew that my video wasn't on. So I never knew that 98% of Filipinos have the opportunity to actually receive financial assistance whenever they access basic healthcare. If you think about it, that's a huge number. I'm sure none of you guessed it at the start of Carlos's talk. That's so many Filipinos being served with financial assistance. Yet, despite that number, we see that there's still so many gaps in our healthcare system. Our next speaker is part of a health startup that's working in filling those gaps by making healthcare services more accessible to everyone. So I'm going to be quickly sharing my screen again to introduce our keynote speaker for the night. So his name is Carl Lang, and he is the COO of LifeTrack Medical Systems. So for those of you who don't know, LifeTrack is a Series A funded health startup. Hold on, I was just muted for a bit there. But let me share my screen again. All right, perfect. So other than that, Carl also has an MBA from Harvard, and he's currently on the board of directors for MedGrocer. So interviewing Carl is our very own Anjali Rasala. So Anjali is leading the Make Sense Academy, our 6-month incubation program for social startups. So just a quick heads up for everyone watching. I'm going to change my slide now. Just a quick heads up, everyone. Feel free to send in your questions to Carl via the Facebook Live comment section while the interview is going on. All right. So I'm assuming you guys already know the drill. To welcome Carl and Anjali to the screen, I'd like all of you again to flood our live stream with likes and heart reacts. I'm going to be unsharing my screen now. Carl and Anjali, you can start when you're ready.
All right, thank you so much for that transition, Joko. Carl, I hope you're ready for this quick get to know you. How are you doing?
I'm good. I didn't know it was going to be keynote. So thanks, Joko, for letting me know.
Well, you are the very special guest that we have for tonight. And be it a format of a question and answer between the two of us, I'm sure it's going to be very insightful for everyone who's viewing this through the Facebook live stream right now. I hope that there's nothing that we missed during the time that we introduced LifeTrack Medical Systems and who you are. But if you want to add a bit more to that, can you tell us a bit more about LifeTrack Medical Systems and some update about what's going on right now?
Sure. So thanks everyone for hopping on and watching, and to make sense for inviting me. As Joko mentioned, we're a health tech company. We were actually founded here in the Philippines, and I joined LifeTrack in 2017. I used to be a management consultant. I was living in Singapore, and actually, it's very personal story because what happened was I lost my mom to cancer, and one of the things that as we were going through that as a family, that I was thinking of was, if we detected the cancer earlier, because she had stage 4 by the time we found out, it could have turned out very differently. So she passed away in 2016. That's when I decided to move back home to be with my remaining family. And thankfully, I met the founder and CEO of LifeTrack at the time, Dr. Eric Schultz, through another actually great nonprofit network for entrepreneurs called Endeavor. And at the time, I was looking to do something meaningful and impactful with my career. So as Joko mentioned, I'd done my MBA in the US. I was lucky enough to get into Harvard. I worked for a startup in the Bay Area in SF. And so I got a taste of early stage companies and realized I really enjoyed that. But at the same time, I'd already agreed to join Bain, which is a global management consulting firm based in Singapore. So to me, this was really an opportunity to work on a company that had something meaningful to contribute. And so what's a problem LifeTrack is trying to solve in a nutshell? As I mentioned, medical imaging, or X-rays, CTs, ultrasounds, all of that is an incredibly critical part of healthcare, because it's how you get early diagnosis, it's how you get early screening. And if you get early screening and early diagnosis, like my mom, if we'd caught it at stage 1 instead of stage 4, she'd probably still be with us today. And so access to medical imaging, affordable access, is something that's a challenge around the world. 2/3 of the world actually does not have affordable access or any access at all to medical imaging. So, one statistic or two statistics I can share, that there are more radiologists. Basically, radiologists are the specialists that read your X-rays and your CTs and your MRIs. There are more radiologists in a single hospital, the Harvard Hospital, Massachusetts General in Boston, than there are in most African countries. So a single hospital in the US has more radiologists than entire countries in Africa. Here in the Philippines or in Southeast Asia, it's about 1 radiologist for every 100,000 people. So in the Philippines, that means that there's 1,000 radiologists for 100 million people. And that's a real issue, because if you only have 1,000 radiologists, they will tend to cluster in big cities, and especially in Metro Manila, because a lot of the hospitals are here. There's more economic opportunity for them as well. And what that means is in outside of big cities, and especially in far flung or remote provinces. I'll give like a real example in Nueva Vizcaya, where we have some customers. There are only 4 radiologists for the entire province. So LifeTrack comes in here with kind of 3 simple things. One is we want to free up more time for the radiologist to see patients, and we do that by not chaining them to need to be driving from hospital to hospital, because the radiologists right now they're like traveling gypsies, right? So in the morning they spend the morning in a clinic, then they drive 2 hours to a hospital across the other side of Manila, and so they waste that time. They waste that time in traffic, and the reason they do that is because the software used by radiologists requires them to be in the hospital. What's called legacy software. So the server is on the hospital, and you can only access it while you're in the local area network or on the hospital. So what LifeTrack's technology does is we've architected our solution so that the radiologist can log on from home, from their phone, from their laptop to the cloud, like logging on to Gmail or logging on to Zoom. And all of the hospital can send the patient studies securely, and sometimes if they want to anonymously to the cloud, so that the radiologist is able to read it remotely. And what that means is the radiologist doesn't need to waste time traveling between different areas. And that kind of, if you extend the logic behind what we do, we have hospitals, for example, the one in Nueva Vizcaya, where the radiologist reading X-rays for that hospital is actually based in Manila most of the time. And so instead of having to be there like once a week, he's in Manila the whole week, but he's able to read continuously for that hospital while he's here in Manila. The second thing that we do is, because our CEO and founder is a radiologist himself, we also built a lot of tools to do 2 things. One is to make the radiologist more productive, so he can see more patients efficiently and diagnose more patients in the same amount of time. And the other thing is we built our own decision support tools, so that radiologists who are, a lot of radiologists, maybe especially the ones who were a little older, they may not be that familiar with the newer machines like CTs or MRIs. So we built our own tools within the platform to help with continuing education and training. So sorry, Anjali, that was, I think, longer than you expected, but I just wanted to share both my story and what LifeTrack is doing to provide context on what we're trying to do, and kind of the following conversation.
That's all right. I'm very much thankful that you actually shared with us not only your story, but a bit more detail on how LifeTrack Medical Systems is currently working right now. I'm really interested in one of the newer updates that you guys have on your page, and this is something that I would like to inform everyone else who is actually viewing right now. For those who are not aware, LifeTrack is currently offering this platform for free, and it helps local authorities identify and prioritize potential COVID-19 patients by using CT scans. Carl, maybe you can tell us a bit about how is this being done, and maybe a bit of an intro of how is it currently being done and how LifeTrack is augmenting that.
Yeah. So we actually recently announced that we launched our project with it's actually with the Antique provincial government during this period of COVID. So we're giving them our technology for free to combat the COVID crisis. So I think everyone here is listening is impacted by COVID. So you're familiar with the problem, which is that we have to test everyone with COVID in order to treat them, and there's not enough testing kits available. So that problem is magnified even further if you're outside of Metro Manila or kind of major cities. So the province of Antique, and I think there might be some people who are watching this from outside the Philippines, but the province of Antique is in another island. It's not a very urbanized province. You have to you have to take a boat to go there from Manila or take a flight. And they weren't really getting access to the molecular testing kits. What you guys might know as the RT-PCR testing kits, because the outbreak started in Manila, so obviously they were prioritizing Manila. But having said that, they still have potential COVID or suspected COVID patients, and they had no way of figuring out, besides monitoring for symptoms, if these potential COVID patients needed to be tested or not. So what they were doing at the time was if they didn't have any symptoms, they would just send them home. So what we did was, and I'm going to share my screen here, was we provided our technology for free. And so that does two things. One is that the radiologist who was working in Antique's main government hospital, she was actually based in Romblon, which is another island. And after the lockdown for the Philippines was put in place, she wasn't able to travel to Antique anymore. So actually no one was there. There was no radiologist in the hospital who could read CT scans. So what we did was we set up our system so that if they take a CT scan in the hospital, they can send it up to our server in the cloud. We also partnered with another artificial intelligence company called Predible, which is from India, that can provide some guidance to the radiologist. So this is the decision support from the AI, which identifies potential COVID features on a CT scan. So something interesting to note is that as more countries have combated COVID, certain countries like China and the UK, for example, are using COVID to triage patients, because some patients that have COVID but don't have symptoms, you can see it on the chest CT scan because it's a disease of the respiratory tract. So actually, since we launched this with Antique last Monday, before the Easter break, they've already found several patients where they didn't have symptoms, so they didn't think they had COVID. But after they did the CT scan, it turns out that they had COVID-like symptoms on their chest CT. So when that happens, they get seen by the primary physician in the hospital. They get prioritized for testing, then and quarantined, and then that's what's used to confirm that they have COVID. If you don't have symptoms and the CT is also clean, you will be sent home instead. So what we've done here is not to replace the current method of testing for COVID, but rather it's to triage and to prioritize who gets tested, especially because the way that we triage right now is simply because of symptoms. And as we know, 1/3 of patients with COVID don't have symptoms. But of that 1/3, some of them may already have features in their chest CT that are indicative of a COVID infection.
That is a very informative stuff, Carl. Sorry, I don't know if I can be heard. You can hear me, right?
Yes.
Hi, cool. All right, thank you so much. I hope when people ask a bit more detail on that, especially those who are in the health sector who are watching right now, if you have any comments, questions, or clarifications for Carl, feel free to comment on the live stream. Or maybe you can stick around later on and see if Carl is still going to be on the air meet for the networking part. But to continue the discussion, Carl, to clarify, this is coming from someone who is not from the health sector. Can you clarify for me if this platform is for free for the healthcare workers and authorities who are using it? Or is it also free for the people like me who wants to get tested if I have COVID-19, for example?
So unfortunately for you to use our platform, you still need to go to a hospital that will have to run your CT, and they will charge you for that. So we can't control for that. We're a B2B company. So we usually partner with healthcare providers like clinic chains and hospitals who use our technology. So Some of our bigger partners here in the Philippines are the biggest primary clinic chain in the country, Family Doc, which is owned by the Ayala Group, and the biggest HMO or health maintenance or health insurance company in the Philippines, MaxiCare. So their clinics use our software as well, and that's all usually on a commercial basis. But as our response to COVID, we're offering this particularly to public health authorities, which are the ones that are getting the brunt of COVID, of potential COVID patients. We're offering it for free for a period that we agree on with them, and we shoulder the cost of training and deployment in the meantime.
Thank you for that clarification, Carl. I'm sure that that in itself is a huge help already for not just the healthcare workers and the frontliners who are currently busy with managing this crisis, but also for the people who wants to get tested. I'm sure that the efficiency will help each and every one of us when we get tested, when we get tested for COVID-19. Okay. I have last two questions, Carl. First, for the people who are watching right now, mostly are active citizens and community volunteers, but are not exactly in the medical field. Is there a way for us to help you or LifeTrack?
I think for us, we're just actively looking for more healthcare partners who could make use of our technology. So one thing we're exploring. CTs are not that common, but in the medical literature, they are more indicative of COVID than X-rays. But we are now exploring, can we use X-rays as well? Because there's a lot more X-rays than there are CTs. But for the ones who are volunteering, you might be volunteering at a hospital, or you might be working for a nonprofit that's partnered with a government or LGU healthcare office. And if this is something that they can use, then please reach out to me. You can get my contact information from the Make Sense team. We're actively looking for more partners to just get this out in the hands of more radiologists, more hospitals, more clinics, and deal with the need to do more testing and isolation of potential COVID patients, so we can really flatten the curve of infections.
Excellent. Thank you so much, Carl. Again, for those who may have contacts that would be willing to partner with LifeTrack, you can reach out to the Make Sense team. We'd be happy to connect you to Carl. And my last question, Carl, for the social entrepreneurs who are in the audience right now and those who will be introduced later on, can you give them a few learning takeaways or points on how they can manage and thrive as health tech startups, especially in the context of this new reality that we have in the COVID crisis?
So, I don't have a medical background either. So I think whether you have a medical background or not, and I really like the example shared earlier by Carlos. Now that if you don't have a medical background, a lot of health tech or healthcare companies, startups, particularly, they're started by doctors, and LifeTrack is the same, and they need people who have more operational or business experience to help them build or take these products and ideas out into the world where they can really make a difference. So I think both. You need people with both medical and non-medical backgrounds to really take health tech innovations forward. So, and if you're in either of those categories, my first advice would be find someone that can complement you. Don't try and do everything yourself, because there's definitely value to be taken from partnering with people who are as passionate about the problem and bring a different skill set and can help you really scale it up. I think second is you have to be extremely patient. I when I came into LifeTrack, I was used to working for more of a consumer tech startup in SF that was in the travel industry. So I did not anticipate how long things took in healthcare when it comes to procurement decisions, training, deployment. Everything just took longer in healthcare, and I got frustrated at first, but I also realized that this is because this is something that touches people's lives and well-being, and so there is definitely going to be conservatism in the medical field, in the healthcare field, and it's our responsibility as kind of health tech startups to meet the burden of proof required. So whether that means that you are making sure you're taking care of patient privacy properly, or in our case, we had to get FDA approval and we had to spend for that. It's not cheap. That's what we needed to do to be considered a serious health tech company, and that's really the burden of proof is on us, not on the healthcare providers like the hospitals and the clinics, because they're not going to put their patient lives at risk if you don't and put them in your hands unless you show that you are similarly interested in doing everything to safeguard their well-being. And I think third is there needs to be a lot of outreach to your medical community that's relevant for you. So in our case, it's radiologists, and I think at first, when you come from, I think maybe this has changed now, but there's definitely this idea that in tech that we're gonna disrupt, and so we can ignore the current stakeholders because we're trying to change the way things are done. And I think LifeTrack was like that very early on, and we realized that that's not really the right approach, because you need to take a stakeholder engagement approach to getting the best out of your technology, especially in a complex clinical environment like a hospital where there might be multiple radiologists, but also the radiographers who operate the X-rays, the clinicians, like the oncologists who are part of the stakeholders that are involved in medical imaging in our case. So there really needs to be responsiveness to their concerns, and it can't just be that kind of that move fast and break things approach that was popularized by Facebook. So there's really a higher standard for us in health tech, and so one of my favorite books for the past couple of years is Bad Blood, which is about the scandal around Theranos. So if you might have seen this on your social media, but maybe 2-3 years ago there was this kind of blonde entrepreneur from Stanford in California. Her name was Elizabeth Holmes, and she supposedly had come up with this machine that it would just take one drop of blood and it could run your full blood exam. And it turned out to be all fake. And so that sets back health tech, and that sets back healthcare innovation. And that's why our customers and partners are all very careful because of scandals like that. So we need to really hold ourselves to a higher standard and meet the burden of proof needed for clinical care and for our medical stakeholders, and engage with them, openly and honestly on the strengths and maybe gaps in the existing technology you have. Because if the gap is big enough that it compromises patient care, then maybe it shouldn't be used yet in a clinical setting. So I think that might be a little in the details that's particular to us, because we work in a lot of clinical environments, and health tech is a big field, and some of it is just direct to the patient or direct to the consumer. But I think having a mentality that you're going to hold yourself to the highest medical and clinical and ethical standards will reassure all the people in your both your patients and your medical stakeholders that you have the right mindset to be in this field.
All right. Thank you so much, Carl. I think I got a lot that I expected, and even more from your unfortunately very short time with us. I know that we only have you for a few more minutes, but there are also a few questions on the Facebook page. It's just that we don't really have time to entertain them right now, and some of them are a bit specific.
Okay.
I'm just gonna encourage people to
Yeah.
send in their questions and comments along the thread, and then maybe they can meet you on air meet later on, or maybe connect with you on Facebook or an email once they drop their details with the Make Sense team. But with that, Carl, thank you so much
Thank you,
for
everyone,
being
and
here with us.
thank you for inviting me to speak here.
All right, thank you so much, Carl. See you in a bit. That is Carl Nang of LifeTrack Medical Systems. Joko, back to you.
All right. Thank you so much, Anjali. Thank you so much, Carl. Everyone watching our stream, can you again flood our stream with likes and heart reacts? Thank you so much, Carl. So you shared an interesting statistic during your talk. You shared that 2/3 of the world don't actually have access to radiology imaging, and that's a crazy statistic because people need healthcare services like that in order to detect diseases at an early stage. And it's really amazing how LifeTrack is working towards bridging that gap. And it's also equally impressive how your team is working really hard with flattening the curve of COVID here in the Philippines. So again, thank you so much, Carl, for joining us tonight. I personally learned a lot from your talk. And for the people watching our stream that didn't get to ask their questions, don't worry. Stay tuned till the end. We'll be giving all of you the opportunity to network with Carl, Anjali, Carlos, the rest of the speakers, and in fact, everyone else watching the stream through a platform called AirMeet. So please stay tuned till the end. I'm going to, we're actually nearing the end of our Sense Night right now. And I would like to introduce the 3 best startups that made it through our Help for All program. I honestly love what all of them are doing, and I'm sure that all of you will too. So since we're nearing the end of our event, I want to make sure that all of you still have energy to make it till the end of our stream. And so, in Make Sense fashion, I invite all of you to do a quick energizer with me. So if all of you could just stretch your neck, look up very quickly, look down, move your neck to the left, move it to the right, shake your hands, and pinch your ears. I'm going to take off my earphones for this. Okay, so I hope that energized all of you. I'm going to be sharing my screen again. All right. So we're now at the last part of our event, and I'm very, very happy to be presenting these 3 amazing health startups. So these 3 health startups are Kasambag, Alaga Health, and Cargo, and they are the 3 best startups that made it through our Help for All program. We're going to be presenting these startups in the form of a talk show that Anjali will be moderating. And again, you guys already know the rules. While the talk show is going on, feel free to send in your questions for the speakers via the comment section of our live stream. So, all right, before I welcome our startups and our speakers, all of you guys already know the drill. Please flood our stream with likes and heart reacts to welcome Anjali and our 3 startups to the screen. Anjali, you can start when you're ready. I'm going to be unsharing my screen now.
All right, thank you so much, Joko. I will be introducing the 3 health social startups one by one to you guys. But before that, let me share my screen as well. Put it here. Sent. Okay, let us get started. And without further ado, I would like to call on Dexter Galban first to introduce their startup. Dexter, can you turn on your mic and your video, please?
Hello, can everyone hear me?
Yes, loud and clear.
That's great. So Next slide, please. All right. So hi everyone. I'm Dexter Galban, the CEO of Alaga Health. And we are a web and mobile application that allows you to consult with your physicians wherever, whenever, and however. And one of the great things that we want to offer is that we're providing different avenues for uh, patients or even regular people who would like to ensure that they are healthy to get to have a better hold of their healthcare. So we offer teleconferencing, scheduling of home visits, clinic visits, and special packages for those that have non-communicable diseases like hypertension, diabetes, and mental health problems. And the crown jewel of our platform would be your doctor on demand, wherein just like when you're ordering Grab or another kind of platform, by selecting this option, you will have a doctor attending to your need in a matter of minutes. And that's something that we hope that a lot of people will be able to benefit from in the long run. More so during this time period of COVID-19, when even going to the hospital is difficult enough. And even when people themselves are afraid of long travels or exposure to diseases. So that's a little bit of something about Alaga Health. And hopefully we could share more about us soon.
Thank you so much, Dexter. Thank you for introducing Alaga Health for us. Let me now call on Mikey and Choice for CareGo.
Hi everyone.
Hello.
Hello. So I'm Carlos Pilapil, one of the co-founders of CareGo. So CareGo is a digital health platform wherein health workers can conveniently store their immunization data for the community. So as we all know, vaccination rates have been dwindling since last year due to a vaccine scare. So with that, CareGo uh, would like to achieve greater than 90% vaccine coverage rates for communities. And through that, we believe our methodology, which is actually backed up by a lot of scientific data, that the presence of electronic health records could actually positively impact vaccine coverage rates of communities. Based on the various studies done by the Philippine Statistics Authority, the current vaccine coverage rate of the Philippines is around 75% for urban areas and 66% for rural areas. And as we know, for us to actually have a herd immunity, which is to protect everyone else, what we need is 90%. So this is very alarming in terms of what we have right now. And even though we actually have a law, which is RA 10152, or the Mandatory Basic Immunization Services Act, there's still this problem. And so with that, CareGo would like to solve that problem by doing this, by offering our service. And also, we believe that through this, by achieving a higher vaccine coverage rate and allowing children to be protected from vaccine preventable diseases, we would be able to unlock their fullest potential and possible for a better Philippines.
Thank you so much, Choice. That is very informative. We'll get back to you for more questions later on. But for now, let us get introduced with Joyce of Kasambag.
Yes, hi. So I am Joyce Anponciano Villafania. I am a speech language pathologist and a reading specialist. I work with, or I collaborate with families on the communication, swallowing, and literacy development of children with disabilities. I educate university students who want to become speech language pathologists. I build capacities of families, teachers, community, rural and urban, from leaders to community health workers. And I work with organizations and local governments. Currently, I'm leading a team working on Kasambag, which is a community-based social innovation. Kasambag stands for Kasama ang Batang May Kapansanan sa Ambag ng Komunidad. So it's a physical product for families with children ages 1 to 3 years old, with or without disabilities, so they can timely do preemptive or immediate evacuation during disasters. And they can efficiently move out of their homes with their go bags and actually safely evacuate. When not in use, it is a bag, it is a chair, it is a flotation device or a life vest. Kasambag is also a social enterprise. Every kasambag is made with a community, its leaders, its local artisans, its women. Community leaders will source plastic waste and locally available materials. They will also identify local artisans and women in their community. And then the team will be training the local artisans to transfer their knowledge to women of the community into assembling kasambag. These women will later on be employed to manufacture kasambag and be recognized as local artisans themselves. So because of kasambag, we envision a society that sees the inclusion of children through the community's collective action. Every community member's action is their contribution or ambag in Filipino language towards the inclusion of children, kasama, in a community program that is coherent of climate change, disaster risk reduction, and sustainable development. Currently, kasambag is the prototyping phase is being paused because of the pandemic, but we are excited to resume once our communities have somehow recovered and bounced back better, especially the families that we are hoping to be working with in the future.
All right. Thank you so much, Joyce. We'd love to learn more about kasambag later on. Without further ado, I would like to get to know more a bit about the teams. If I could hear from Mikey and Choice again of Cargo. My question for the panel now is, what is your background and what made you start your projects and startups in the first place?
So for me, it is actually a very personal one. And my background is more on the life science research. I'm currently doing antibody research. So my previous work was about vaccine development. So, and actually Mikey and I work together in that under the same department who's trying to develop vaccines. So with that, for my motivation, it was actually very personal. A family member of mine had a health condition wherein there are different opinions from various doctors, because we tried to seek different perspective on what his health condition was. And so as they know that I'm a life science researcher, they saw that maybe I would be able to know some of the jargons that is being delivered by the physicians, because I'm not a physician myself, I'm a researcher. But through my studies, I'm a little bit familiar with some of the terms. So my family members was asking me about some of the terms, but however, I tried to ask them, do you have the health record? Because I would like to know that, if for me to be able to in some way understand what is the complete picture, or what could be the difference in the perspectives of the different doctors. However, we have we came to a point that this is actually a problem, because they actually don't have that. And so it came to my idea, I think it's not only me, it's not only me who has this problem. And so I think it's time that we should have this. And so I tried to search online. And so it is actually a very big problem. And in the Congress, it's actually being pushed that a health record should be done. And so luckily, my partner and I, Mikey, attended the December 2019 Health for All Hackathon, wherein we've met people who came from the same backgrounds. And so with that, we tried to pitch the idea, and we met Sherry, who is a software developer, and Keith Satinitigan, who is a product designer, and Rafi, who is a innovations systems. And so at first, we are very energetic about this idea. We should create a health record and all. And then we got for the Health for All sprint, and we've again we got our idea more refined by this time, and we knew and we were kind of heartbroken that medical records are already existing in this country. So why is it that integration into our health system is much of a problem? And take note that these companies have a lot more funding than we do, have a lot more connections than we do. And so it came to a point that our mentors have actually suggested to us, and of course, my buddies who are also here, hello, who has informed us, who has suggested to us, who have suggested to us that maybe we should make it in a more limited scope, but with a great impact still. And so we have concluded that in more limited scope but with great impact, I think vaccines would be of much help. That's why we came to this point that from a complete medical record, we came to records for immunization because it's still much of a big problem. And imagine if we could increase the health of all these children, later on, this would have a great impact. Maybe not the same with if we have the health records right now, it's too much big for problem for us. So we're trying to do it on a smaller scale as of now. But if you get lucky, and if you'd be able to implement it into around 18,137 barangay health centers, why not, right? So I hope everyone would be able to support us and join us in our mission. Thank you.
Thank you so much, Choice. For those who didn't get to catch that, Choice and even Mikey actually are both part of the Research Institute of the Tropical Medicine here in the Philippines. So they're both working on managing the crisis of COVID. Let's also now welcome Joyce again of Kasambag to quickly tell us about what motivated her to start the startup.
Hi. I think I forgot to mention that I've been working with children, or actually persons with disabilities, for more than a decade. But I prefer to work with children. But I was a person with temporary disability for 5 months while I was recovering from right kneecap dislocation. So my kneecap got dislocated. For 3 months, from a physically abled person throughout my life, for 3 months, I was very dependent on a wheelchair and the cane. And then by the 4th month, I progressed to managing with a cane. You could ask a many ortho expert, and they would tell you, also rehabilitation doctor, and they would tell you that my progress is really slow. So on the 4th month, I managed walking with a cane. But I had to walk very slowly. Imagine 30 meters per minute. That's really slow, and I had to take frequent breaks. And on that same month, I experienced an intensity 5 earthquake while doing my daily physical therapy walking exercise at home. It was a 27 disaster. I didn't know it back then, but it felt like 2 minutes of being frozen, helpless, and being clouded with fear. I couldn't walk to hold on to a wall that was just 2 meters away because I was so afraid of being further disabled. In fact, I couldn't even do the duck hold cover because I couldn't bend my knee at all. I survived because of our dog, who hurriedly came when I called him and calmly sat beside me. If not for our dog, I would have fallen over because of that earthquake. So with that experience, I empathized with all the families with children with disabilities that I have worked with. I thought, as we are living in the world's 9th highest disaster risk country, how can the estimated 8 to 20% of Filipino children living with disabilities survive such an even more disastrous event when global statistics say that throughout the world, only 20% of persons with disabilities can do so without difficulty. That's why we were inspired by the indigenous practices of the Ifugaos here in the Philippines of a child carrier. We were also inspired by the cradle boards of Native Americans. So we thought of innovating this, but together with the community, for families with very young children, ages 1 to 3 years old, with or without disabilities, to use a sustainable product that will reduce their vulnerability and at the same time strengthen their resilience in disasters. And we call this kasambag.
This is a very inspiring sharing, Joyce. Thank you so much. And I'm sure I'm not the only person speaking here when I say that dogs are the absolute best. But thank you so much for sharing that, Joyce. I want to welcome Dexter back onto the screen so that he can tell us about what motivated him and the team to start the project called Alaga Health.
Dexter? Hi, thanks for having me back. Alaga Health is actually a product of seeing medical knowledge and technology coming together. Well, on a personal note, I'm a physician in training with a background in business. And I met my partner in this business, Juan, who is a UI UX designer, in a hackathon. And it was then that we got to talk and realize that there's something that needs to be done. Just a little bit of a story. Even way back when I was a young nurse, I would see as early as 3 or 4 in the morning patients in Philippine General Hospital lining up so early just for a chance to have a consult with a doctor. And years after now, I am in medicine and I would do checkups on patients, and some of them would be lining up as early as 5, 4 in the morning, and I would get to see these patients at 2 or 3 in the afternoon, and they would still go through with that long wait. That includes their fare, their food, all of the toxicity of waiting that long for the chance to be able to be seen by a doctor. And for me, for them to get just 15 minutes and all of that, that's way too much. And that delays so much healthcare for us. And in a country wherein 8 out of 10 Filipinos have never had a medical checkup, and wherein 6 out of 10 Filipinos die without seeing a healthcare professional, we believe that there is something that needs to be done. And I agree with the team of CareGo, electronic health records are a way to go. That's why that's something that we have planned down the line. But for now, we wanted to respond to a critical need, especially even at a time like this where people are scared. A simple cough can actually be COVID or even none at all. And for us to give them that sense of relief that they can seek their consultation wherever they are, saving them of all of the expenses, having no fear that they can be safe whether they are at home or at work, that someone will be there to care for them. I think that's something that's very important for us to do, and that I believe people, at least in the Philippines, really need to take into consideration. Alaga Health was developed with the purpose of serving as many people as possible, because healthcare is known that happen, whether that's through telemedicine or whether that's by providing you with other options like home visits. Then I believe we have done our part into making this country a little bit better in our way.
Thank you so much for sharing, Dexter. This is very relevant for everyone here, because just the peace of mind of getting an assurance or some update on whether we are carrying the disease or not would be something that is very helpful for everyone, really. And having a service that is accessible from our own homes, it's revolutionary. Thank you so much for sharing this, Dexter. We only have a few minutes left. So with the very short time that we have, I have 3 more questions for the panel. Now I would want to ask, for the viewers, actually, for all of those who are watching from their homes right now, as you may know, and you may have noticed, all of our speakers are working in the health sector right now, and a lot of them are actually frontliners in this crisis. I want to hear from the panelists from the 3 teams. a very simple question that I want you guys to answer. Aren't you guys overwhelmed? I mean, you guys are working in a very in-demand work right now, which is in health. And this is something that's very, very important and very, very urgent as well. And at the same time, you are still managing a budding startup. Again, aren't you overwhelmed? I want to hear from Mikey and Choice of Cargo.
Hi, Anjali. Hi, everyone. So I'm Mikey. I'm from Cargo. Troyce and I are actually frontliners at the Research Institute for Tropical Medicine. And I'm pretty sure you guys have heard about RITM in the news recently. We're the ones conducting the COVID-19 tests. So specifically, we extract the genetic material from the samples with the inactivated viruses for testing. So I admit that, yeah, it can get overwhelming, especially when we're on duty for 12 hours and then we have to get some deliverables done for Cargo. But somehow we're able to manage our time by planning things ahead for Cargo and starting in them as early as we can. These are different and difficult times, so it's actually hard to adjust, and it feels weird to be used to this different kind of normal that we have today. But for me, I continue to do it because I know the value in what I do. Of course, I feel afraid as well, but I know that I can do something. Our country needs to properly report the cases, and this is an urgent matter for the health of the Filipino people. So, for Cargo, I believe that it's related in a way that it concerns our health. And if we get to have a vaccine soon, then Cargo can help in the distribution of that. It is physically tiring, it's overwhelming, but I think commitment is key. Um, I'm committed to being a frontliner because I know that I get to help people, and I'm also committed to making Cargo work because I believe in the value that we can offer for our local communities and for our frontliners as well in the future, because I myself understand their struggles. Thank you.
Thank you so much for sharing, Mikey. And we also appreciate the commitment that you and everyone else in the health sector, even those who are not in the health sector that are frontliners in this battle against COVID-19. Thank you so much. Maybe I can go next with hearing from Dexter. Dexter, you are in your health uniform. It would be great to hear from you about your feelings. Like, aren't you overwhelmed with all the things that are happening?
It's actually very daunting, more so that unfortunately a lot of our colleagues in the health sector are either getting sick or passing away because of what's happening. And that's a big trigger for us to keep moving forward with Alaga Health because, as you know, the inflow of patients in the hospital has focused on COVID-19, like right now. However, at the same time, you still have patients that have hypertension, diabetes, mental health problems, and they have very limited capacity to go to these institutions that are already overworked and overstretched. And for me personally, I think that's very stressful. And to see wanting to give more but unable to do so because of lack of resources, lack of time, trying to find other ways for us to be able to help people is very integral. So, for example, during the entire duration of the COVID-19 epidemic or pandemic, actually, we had to pull out some of the medical practitioners or health workers who were already exposed and were more vulnerable to the disease. And yet, these people still want to help with Alaga Health, they could do their online consults and still serve a lot of people. And at the same time, we have consultants that are more elderly and are not actually in the front lines, but are unable to do the regular duty cycles because of higher possibility of getting the diseases. And that's still something that we hope to bring them in to serve even more people because at this time, every kind of help counts more so when it comes to the health field. So to answer the question very briefly, I think the audacity to hope, even in this crisis, is something that keeps us going, even if it's difficult.
I love that quote, Dexter. The audacity to hope is something that will keep us going. And I hope that everyone else gets to take from the strength that you just shared with us. Thank you so much, Dexter of Alaga Health. Now, of course, I'd love to hear from Joyce. Joyce, tell us about how you're feeling. Aren't you overwhelmed with everything that's happening right now?
I'm not overwhelmed because I'm very overwhelmed. In the context of a disaster, Kasambag's collective action saves lives. We are in a disaster. It's just that we're responding to a very different nature of a disaster. Yet collective action is very necessary to provide a very humanitarian response to this very complex global health emergency. So I'm doing just that. I've been sharing my research on telerehabilitation to make sure that persons with disabilities are still receiving their rehabilitation services. I'm volunteering to I'm in the process of adding in another Filipino language, an alternative communication for our COVID-19 community members who cannot talk because they have difficulty breathing, they are in ventilators, and they are intubated. But to also share, it's so challenging to organize a small community, a condominium community that I live in, to provide my advocacy of a very inclusive humanitarian response. And it's very also difficult personally to continue being a source of information and psychosocial support through various social media groups, to random individuals, to individuals I don't know who ask about questions on what to do for their loved ones, what to do in their communities. But I see my contribution as part of the collective action, which is very crucial now to society's pressing needs as of the moment. And I'm doing that. I think same with Mikey. I'm doing that as a personal obligation and a professional obligation and a personal responsibility to the society.
Thank you so much for sharing that, Joyce. I'm hoping that the overwhelming feeling would pass and also, flatten along with the curve that everyone is working on to flatten right now. And again, I cannot say this enough. Thank you to each and every one of you out there who are working in the front lines. May you be in the health sector or outside the health sector. If you are risking your life and your safety for everyone else to continue living their lives, albeit being a bit limited right now, thank you so much for your service. I have 3 more questions, and we have around 15 minutes left for the panel discussion. I hope that the speakers that we have won't feel too pressured, but we have only a few more minutes. Let me kick off the next question. I want to ask, what can consumers or us in the audience, what can we expect from your startup in the next few months? Let's begin with Kergo.
Hi, okay. So once Cargo is launched, we would have partner municipal or city and barangay health centers who will be using our service during their scheduled immunization programs. And by the time we launch, we're done with the application for the health workers to help them in the planning and the management of the immunization processes. So they can expect that we'll be fully functional to help them. And once we've established our service, then we'll start to work on the patient portal where they would have access to their data. So especially the parents and the guardians of the children. Yeah, so that's it.
Thank you so much, Mikey. Very exciting stuff. I want to hear from Joyce of Kasambag. What can we expect from your startup in the next few months?
Kasambag commits to children with disabilities. We commit to women, and we commit to present and future lives of communities. For families of very young children, with or without disabilities, ages 1 to 3 years old, we can assure that the product is lightweight, it's durable, and it's a space saver to promote the health and prevent further disabilities. We are going to make it durable to carry up to 18 kilograms of load, which is the estimated weight of Filipino children until 8 years old. It is lightweight to care for the health of the family members who will be carrying their children on their backs. And it is a space saver at home because it can be deconstructed into 3 separate products: a bag, a chair, or if it's going to be used by children with disabilities, it's in an adaptive seating, and a life vest. Second, women can be assured of livelihood and be recognized as local artisans to actually promote gender equality and equity. Third, since Kasambag addresses plastic waste by using it together with locally available materials, we commit to meeting current needs while thinking about the lives of future communities through sustainable development.
Very exciting product, Joyce. Thank you so much for sharing that. And we are definitely looking forward to seeing Kasambag out in the market. Now, I'd like to hear from Dexter of Alaga Health. What can we expect from your startup in the next few months?
In the next few months, we hope to launch our array of services. So the main focus of Alaga Health is really to give patients and people in general the option to choose how they get their healthcare. Of course, one of our primary services would be your teleconferencing. So you can view and talk to your doctor, whether through your laptop or whether through your phone. At the same time, however, this is not going to be as easy during this COVID pandemic. We could schedule your clinic visits for you and even get home visits. We can get a health professional to go to your home if that would be your option. So this is particularly important for patients that are unable to travel, like those with stroke or those that are bedbound in their homes, as well as we want to offer you packages, especially for those that are hypertensive, those that are diabetic, those with mental health problems. Those are the things that we are hoping to offer to our patients and to everyone else. But at the same time, we took into consideration the young doctors that we hope to bring in, because now they don't have to pay a lot in order to set up a clinic in a hospital or another area. They can do their practice online, even in their home clothes, just put on a coat, and they'll be able to conduct and establish their presence online and to their patients. So from both ends, from patient to the healthcare provider, we hope to provide the solutions that they need when it comes to healthcare.
Excellent. Thank you so much, Dexter. That is something that everyone should look forward to, and I know that I am personally looking forward to in the next few months. Thank you so much. Now, let's go into my second to the last question. Of course, we are all curious about the team behind each of the startups. Perhaps I can call on CareGo first to quickly introduce the team behind CareGo.
For our team, both Mikey and I are on the life sciences research side. So we're both on the technical side of things regarding vaccines. I'm an antibody researcher and she's a molecular biologist. While Sherry and Keith are the ones who are responsible for the development of our prototype and also for the creation of our app that would be later on. We hope that could be deployed for the use of the health workers and the patients, fully integrated into their systems. And while Rafi is of the innovation systems from Jollibee, into which he offers some insights regarding our work.
Thank you so much. Everyone in the audience, you will have a chance to meet the people behind CareGo later in the networking session, so please stay tuned. Now, I would love to hear from Joyce. Tell us about the team behind Kasambag, please.
Yeah, so the team that will make Kasambag happen is composed of is coming from very diverse professions, but with the right expertise in health, disaster risk reduction, community organizing, and research. I am the katuwang, or the society's partner in addressing health, social, and environmental issues, and the tagakumpas, or the orchestrator in managing the team. Michael Celis, is the tagapagdaloy, or in charge of the flow of logistics and operations, while Harian, is tasked to care for social, human, and financial capitals as Kasambag's assets, or yaman. Later on, we will be joined by four more members who share the same expertise, and with an addition of someone working in the Air Force with humanitarian assignments.
Thank you so much, Joyce, for sharing with us the people behind Kasambag, and we are looking forward to hear from everyone. And now I would like to hear from Dexter about the team behind Alaga Health.
Hi, so I cannot put into words how proud I am of my team. I love them so much. I'm currently serving as the CEO, co-founder also. So I'm a physician in training and a registered nurse with a business background. And I am joined by our COO, who is Von Payumo, a UI UX and graphic designer who owns his own freelance agency. And he is a multiple time hackathon winner. So very, very much proud of this guy. At the same time, we have our CTO, our Chief Technology Officer, Bon de la Cruz. To those who are wondering if we will be doing electronic health records, yes, we will be doing that because our CTO actually has a background on that. So he's an expert when it comes to mobile application development. He's a full stack developer, really proud of that. And we also are joined by our CFO, Earl Andes, who is actually a certified public accountant. And just a little bit of tidbit, he is actually one of the brains behind the financial structure of Tim Hortons in the Philippines. So he's actually working with digital banking and is very familiar of how to make health and digital financing happen. And I'm also proud of our CMO, Justine Ortega, who has a lot of experience when it comes to consumer goods. So from your Quaker to even technology goods like Sun Smart and several others. So really, really proud of my team, and hopefully we can serve you all better moving forward.
I am glad to have met, albeit just on the presentation for now, the team behind Alaga Health, and of course the teams behind Cargo and Kasambag, who were introduced a bit earlier. Again, for those who are watching, stay tuned. You will have the opportunity to meet with these people, including perhaps Carl later on during the networking session on air. And finally, my last question for each and everyone on the panel: how can the people viewing right now, how can we help you with your startups moving forward? I would like to start with calling on Mikey and Choice of Cargo.
Hi, so we believe that no child should die from a preventable cause and that all children should be able to reach their full potential in health and well-being. And that's a quote from UNICEF. And we in Cargo also believe in that. So if you want to support us in our social mission, we would like to invite everyone to like our Facebook page at facebook.com/CargoEMR. We are currently releasing a Vaccine 101 series to educate the public on what we should know about vaccines and why we need to have our kids vaccinated. We also have a chatbot created by Troyes, and it's actually called Tito Cardo. So you can talk to Tito Cardo to know more about what Cargo does. And if you want your community to have Cargo, please talk to him, and then Tito Cardo will be asking for your details if you want to refer doctors or health workers who might be willing to try our service. So yeah, if you're someone with a kid at home or you're a concerned citizen who want to improve your community's public health, then we'd really appreciate your initiative to help us in our community partnerships. Thank you so much.
Thank you so much, Mikey. For those who are watching right now, please do follow Cargo on Facebook as soon as you can and stay up to date with the news from the team. Next, I would like to call on Joyce. Joyce, how can the viewers help you and Kasambag moving forward?
So after presenting Kasambag, thank you for this opportunity to present Kasambag. We hope that Kasambag will make you a kapasan in sharing the load in solving society's health, social, and environmental problems. If you are, we hope that we become katuwang or partners embracing diversity and believing in collective action for social inclusion. Because the only way for us to achieve a society that works for all is for society to be developed by all. And if you are both kapasan and katuwang, then you are supporting Kasambag as we are together in this collective action that saves lives. To see a society where kasama ang mga batang may kapansanan sa ambag ng komunidad.
Thank you so much, Joyce. To the viewers, Kasambag has a Facebook page. Please follow that as well and be a kapasan. Thank you so much. And finally, I would love to hear from Dexter. Dexter, how can we be of help to Alaga Health moving forward?
Well, I'd like to invite everyone to like and share our Facebook page. So that's facebook.com/alagahealth. And we have been releasing so many medical updates. So when it comes to becoming in the know about health or what's happening even right now in COVID, we are there for you. So you can actually send us a message as well. So if you have medical inquiries or questions about health that you think would be very immediate, you can actually send us a message so that we can give you a taste of the kind of service that we can provide you as part of Alaga Health. And hopefully we can send you freebies and discounts, particularly those who sign up early, so that we can give you better service when we actually fully launch the service.
Thank you so much, Dexter. We are very much looking forward to getting to know more about Alaga Health. And again, for those who quite missed that, they have a Facebook page. Please do follow the team on Facebook so that we can get up to date with the latest news from Alaga Health. And that concludes the panel questions on my end. We are now going to entertain questions from the audience. We have a bit more time to entertain them. I would like to give the panelists a few moments to take a breath before I ask you the questions from the panel, from the Facebook live stream, rather. All right, I have a question here from Mark for Cargo. So Troyce or Mikey, you can answer this. As opposed to a health worker-based record system, is there a way to involve the families or parents via a personal app?
That is what our team is currently looking at now. But as of now, we're focusing on having more connections regarding the barangay health centers, and hopefully later on, if we'd be able to integrate fully our system towards the barangay health centers, and they'd be very open about having the people who are receiving vaccines to be able to have an access to their own data, maybe through mobile. We'll be developing it later on. But as of now, we're still on the prototype stage, so we're focusing on the healthcare worker side.
Thank you so much for sharing, Troyce. I have a question now for Alaga Health. Dexter, would you see Alaga Health possibly including offline connectivity in the future for those who cannot access the internet?
That's something that we are really working towards too, because that would require a lot of infrastructure and a lot of support from telecommunication companies. But what we're working towards for is SMS connectivity, so that you could get your responses to health inquiries or questions via text messaging. So I think that would be more available, especially when you go to the outskirts of Metro Manila, wherein it's more difficult to access, especially when you go up to rural areas that don't have that much connectivity. So that's something that we're really working towards to, and hopefully we'll be able to provide that down the line.
Thank you so much for answering that question, Dexter. I have one final question, and this time it's for Joyce of Kasambag. Joyce, if you could tell us a bit more about how far along the product is right now. Earlier, you said that it is being designed and that you have a pool of women who are now the artisans of the product of Kasambag. Can you tell us a bit more about how it is going right now, and any updates would be really appreciated.
Yeah. Unfortunately, we had to pause the prototyping phase because of the lockdown. The prototype is in a local community right now. It's in Angeles, Pampanga, and so that's one thing. And another thing, I don't think it would be, we have to be empathic, and we need to wait for communities to recover before we can resume. And because I think we have to also consider that we are in a disaster, and we have to make sure that everyone and everything is at bay and manageable. But once everything is okay, the team is prepared to resume prototyping in this new normal type of society.
That is true, and that is a very exciting update. Thank you so much, Joyce, and we look forward to seeing your product out in the market. And that goes also for Alaga Health and CareGo. That concludes our panel discussion for now. If you have more questions, and I know that you have a lot more questions for the panelists, join us on AirMeet shortly after Joko's reminders. And now I bring the mic back to you, Joko.
All right, thank you so much, Anjali. So once again, everyone, that was Kasambag, a startup aiding children in disaster preparedness. Alaga Health, a startup connecting patients to doctors via mobile app. And CareGo, a startup that stores the immunization data of communities and manages immunization processes. So I'm sure you're all excited to meet our amazing startups and our amazing speakers. I'm going to be sharing my screen in a bit to show you exactly how that's going to happen. So this is the surprise I was telling you guys about. I'm sure you guys are going to love it because I love the platform so much. So I'm hoping you can see my screen right now. If you can, this is basically the platform that we're going to be using. It's a platform called AirMeet. And basically with AirMeet, AirMeet tries to bring the in-person event experience online. And so through AirMeet, again, you'll be able to network with our speakers as if you were in an in-person event. It's super duper exciting. It's super duper cool. I really love the platform. I've said that a lot already. And really all you have to do is click on this link. It's https tinyurl.com/health-sensenight. That easy. All you have to do is click on the link, log in, and you can directly network with our startups and amazing speakers. So what's really cool about AirMeet, so I'm going to be showing the features of AirMeet right now. So once you've logged in, once you're in the AirMeet, you're going to get access. You can use this general chat box on the right side of your screen. So you can use it to send messages to everyone in the AirMeet. Super simple to use. And to network with our speakers and to network with our startups, what you can do is you can join virtual tables. And when you join a virtual table, what happens is, a private video chat opens up with you and everyone else in the table that you're sitting in. And that's where the networking happens. That's where the magic happens. And that's where the connections happen. So I know that this is a very new platform, and I'm sure that a lot of you are hearing about AirMeet for the first time tonight. So I've prepared a couple of FAQs before I invite all of you to head on over to AirMeet. So do I have to download an app to use AirMeet? No, you actually don't have to download anything to use AirMeet. All you have to do is to click on the link for the AirMeet. to join, and you basically just sign in with your email address. What's really cool about AirMeet is that the platform is available on both desktop and mobile. So my team in Make Sense, they're going to be sharing All right. I got disconnected for a bit, but I'm going to be sharing my screen again. Okay. Second question, how do I network on AirMeet? It's very simple. Once you're in the AirMeet platform, all you have to do is click on the virtual table. And what's going to happen is all of the people in the virtual table that you're in are going to open up a private video chat with you, and you can talk directly to the people in the table that you're in. Question number 4, what do I do when the table is full? Super simple. All you have to do is wait until a table opens up, and then you can simply join that table by clicking on it. Once you're in the table again, you're going to join a private video chat with everyone in the table. Last question, what if I don't have a microphone or a camera? Don't worry, you can still join our AirMeet networking event. All you have to do is really just click on tables. What's cool about AirMeet is that once you're in a table, you have the option to chat with everyone in the table via private chat. So it's super duper cool. You also have the option to chat with everyone using the general chat box. So again, this is the link to the AirMeet. All you have to do is click it to log in. It's tinyurl.com/help-night. And that's all you have to do to network with our speakers and our amazing startups. So I'll be seeing all of you there. I'll keep the link up on the live stream for 2 minutes. And after that, I'll be ending the live stream and I'll be seeing all of you there. So thank you all for tuning in to our live stream tonight. And again, I look forward to talking to all of you and networking with all of you in AirMeet.